So I was walking downtown, and it occurred to me that Bitcoin and country music have a lot in common. Decentralized, full of outlaws, and if you lose your keys, you lose your truck, your dog, your soul. So I'm John Young. I've been in the benefits business for 40 years, and I was very fortunate to help develop and launch the HSA. So I'm a zealot on consumer-driven healthcare, which is in fact what you guys are talking about, where the individual actually drives their health outcomes, they drive their health purchasing and choices, right? And before we meet the builders next to me, I just want to address what's in the room. We're just coming off a cycle where employers have faced an 11, 15, 20% renewal for their healthcare plans, their premium renewals, right? And just to pile on what Stu had to say, this is not working. And employers know it, and they're ready for a new idea. They were ready for consumerism in healthcare, this idea of giving people money and helping them make different decisions, but they're ready for new ideas, and I love what I'm hearing in this room. So the other thing I want to say before we meet the builders is that the current system is kind of like it's like a leaky bucket. The currency that's in it, starts to drain because of inflation over time. And these guys are not here to patch the holes. They're creating kind of a new idea where, where basically the money holds weight, the physician knows your name, and the community has your back when it comes to healthcare costs. So join us as we take a little journey from an employer benefits perspective, a Bitcoin and HSA, and a health improvement perspective, and in a crowdsourced healthcare solution perspective, okay? So let me, if you don't mind, I've got to hit some notes here. Yeah, all right. Let me introduce the builders. John Gordon, what can you say about John Gordon? Okay.
Nice hair.
Yeah.
Cut off 8 inches recently. It just keeps coming back.
Thank you for that.
I can donate some to you.
Well, I always tell my fiance that grass doesn't grow on a playground. So, bad joke. I got plenty of bad jokes. So what can you say about John? Besides world traveler, he's a yogi. I don't know if you guys know, this guy is like the Renaissance man. But he's the co-founder, chief operating officer of Sound HSA. I'm going to have him introduce what they do and how they do what they do. And then, of course, we got Andy, and it's Schoonover. I had to look that up. It's a Dutch word. Do you know what it means?
It was von Schoonhaven, and they changed it to Schoonover, which I think von Schoonhaven means safe harbor.
Very, very nice, yeah. And that's a great, absolutely poignant last name for you to create Crowd Health. So I'm going to have you as well kind of introduce your organization. So start with John.
Yeah, thanks so much, John, for coming up here and bringing the traditional healthcare experience, and also have a lot of gratefulness to Andy, really full circle, sitting up here with you, helped bring me into the Bitcoin and healthcare industry, which I think now, seeing the people in the room here, we really are getting a source of builders and physicians and others who get it and who are opting out of this broken fiat system and building a new one with Bitcoin. And so I got my start out of college doing strategy consulting for hospitals and health systems. So I was sitting in the C-suite with these operators at bigger growing health systems everywhere from Yakima, Washington to Bangor, Maine, in Michigan, all over the country, and seeing these problems in 2015, 16, 17. We actually had a forecast 10 years out for healthcare, and what was the demand going to look like 10 years out, and how do you need to position your services, and should we go and build this $100 million inpatient tower because our 700-bed facility is fully booked, or do we invest in ambulatory surgery in our physician networks? So for me, it was a great way to really dig into the health system on the provider side, but even then, even in those C-suites, the financials were pretty much a black box. It weren't discussed too much. I mean, you have prioritization, but it was a deeper layer, and I went into work at HCSC, which is Blue Cross Blue Shield of Illinois, New Mexico, and Texas, and Medicaid, and was in the government programs and deeply saw how those financials were broken and how they were losing hundreds of millions of dollars a year trying to take care of the Medicaid population. Overall, then went to medical supplies, working at Medline. And when COVID hit, and we were getting all of our gauze from China, well, that was a problem. They didn't come back from Chinese New Year. And you see the supply chain disruptions and the physical supplies in the hospital that are necessary for this whole engine to operate. And during that time, I was doing a double master's in health economics and policy, studying different health systems around the world, and really trying to understand how the payment of healthcare impacts the outcomes. And you have a whole host of trade-offs. There's no perfect system, but ultimately you have this third party, whether it's the government or here, private insurance as well. And so that's when COVID hit, and I was getting married and was starting to ask the question, what is money? Went down the Bitcoin rabbit hole pretty hard and fast, and ultimately, after going to El Salvador in the end of 2021 and seeing what Bitcoin life looked like from this bottom-up grassroots perspective, several years ago, walked out of that first adopting Bitcoin saying, why is there anyone working on healthcare? And it seems, we have mining, we have finance, it makes sense to start here, but can we do this in healthcare? And so that's when I heard Andy on the podcast with probably Marty and with Jimmy and others talking about this alternative in crowd health. I was like, hey, send him a DM. Can we come work on Bitcoin and healthcare? And so gave me the job, led to Austin, and ultimately into this world where we have consumers and now suppliers who I've been working with on the consulting side, helping doctors and dentists and others integrate a Bitcoin strategy, start to accept on the merchant side, and now with what we're trying to do with Sound HSA, ultimately put purchasing power within this triple tax advantage wrapper to spend on whatever you deem valuable. Everyone is human. We all have this health experience, and that's where during this time, doing the yoga teacher training and studying breath and movement and all these other aspects, we all have the power to take control of our own health, but it takes that conscious decision. So that's a little bit long-winded, but my background and kind of what got me up here.
That's awesome. Andy, a little introduction of you.
Yeah, Crowd Health is my second healthcare company. I ran a healthcare company for about a decade, and I sold that to a private equity firm, and I swore I was never going to do healthcare again. I was actually selling into health plans and saw all these non-economic decisions being made, and I was just frustrated, and I was happy with playing with my kids and playing golf and going fishing, which were my loves. And as when I sold my company, I didn't have health insurance because most of us get health insurance through our employer, and so I went to what I thought was my only alternative, which was the healthcare.gov ACA plan, and I kind of joked it worked until I had to use it. My little one was screaming bloody murder for days and days. We went to the ear, nose, and throat doctor who told us she had a perforated eardrum. In essence, the fluid in her ears were building up, and it was just popping her eardrum. And the ear, nose, and throat doctor was like, not a big deal, but we have to do it now because I'm starting to see some scar tissue in her ears. And so we're like, great. He's like, no big deal. It's a 15-minute procedure. So we went in network. We got it pre-authorized by the health insurance plan. We got the bill, and it was $8,000 for a 15-minute procedure. So I was like, holy shit, $8,000 for 15 minutes. But this is what health insurance is for. Like, this is the whole point of having health insurance. Little did I know, a few weeks after that, I got a nice note via snail mail, funny enough, from my health insurance plan that said it was medically unnecessary. We're not paying for it. Went through 2 rounds of appeals, and at the end of the day, I had to stroke an $8,000 check out of my own pocket to pay for this. And as you can imagine, I was pissed. So I called my health insurance plan. I said, I quit. If you're not going to pay my bills, I'm not paying your bills. And so I looked at my wife, and I said, we are uninsured. And she looked at me like I was a crazy person. But I started paying my bills. We started paying our bills directly without having health insurance. And I found, wow, we were getting way better rates by paying directly than if we had health insurance. That doesn't make any sense to me. And we can get into why that is later. But ultimately, I thought to myself, well, what if we got a group of people who would come together and fund each other's healthcare expenses so that we could all pay direct and get these really great rates? And that was kind of the impetus for starting Crowd Health back in 2021. So we, over the last 5 years, we have 30,000 people who are now funding each other's healthcare expenses. And just to give you a difference of price, I went on the ACA plan for this year just because I was curious what it was going to be for me, my wife, and my 2 girls, and it was $1,400 a month and a $16,000 to $18,000 deductible, depending upon what plan I chose. And so I'm basically paying $30,000 before the health insurance plan pays a dime. With Crowd Health this month, I'm paying $520, and I'm paying the first $500 of any health event. So I'm saving my family easily $10,000 to $15,000 a year, and we've saved our members about $70 million now over the last 5 years in healthcare expenses. We are extracting that money out of the healthcare system. We are putting it into the pockets of people, and we are, through a number of mechanisms, creating a market-based forces in healthcare. So where does Bitcoin come in? I'm kind of posing as this, alternative to health insurance platform, but ultimately, we about 15 to 20% of our customers are Bitcoiners, and we know that because they saw us on TFTC or Safes or Breedlove's or Natalie's podcast, and so we know they're Bitcoiners, and we know that they want to pay in Bitcoin. The problem we have is who's selling in Bitcoin. You have to have the demand and the supply side of this, right? And so ultimately what we want to do is get a big enough Bitcoin population so we have enough buyers so that we can then go to some of these hospital systems and say, hey, will you be a seller in Bitcoin? And we're actually talking to one of the largest hospital system, one of the top 10 largest hospital systems in the country currently, about being a seller in Bitcoin. As we get more buyers, we'll get more sellers. And so it's a bit of a chicken and egg problem, but we're trying to build this as big as we can, as fast as we can, with as many Bitcoiners as we can, because I think Bitcoin as a medium of exchange is very, very important.
Thank you. I want to double click on the savings. How much did you save for your family, and how much for these 20,000 people that are in your organization?
Yeah, our family is going to pay about $520 this month. That's versus the $1,400 with the ACA plan. So I'm saving almost $1,000 this month just for my family. So yeah, a family will save somewhere around $10,000. An individual will save somewhere between $2,000 and $3,000 per year.
I can tell you, working with a lot of CFOs and companies, that's the stuff that gets their attention, right? So I want to make this conversation useful for all of you. I want it to breathe. So I want you to think about some of the things we're talking about and come up with questions, because you'll have some time for that. But I'll start with some for John. Just first of all, I want you to describe this HSA model that you've come up with, because everyone has heard about the triple tax treatment of these HSAs, but why is it particularly poignant for HSAs and Bitcoin in your space?
Yeah, thanks, John. So I think that the HSA and Bitcoin are really a match made in heaven, right? This is the only tax-advantaged account in the U.S. that is triple tax-advantaged, meaning on the way in, it's pre-tax dollars from an employer or tax-deductible for an individual. No taxes on the gains, right? Everything people are worried about spending their Bitcoin because of capital gains taxes and trying to account for this. Well, now if you spend your Bitcoin out of the HSA, there's no taxes. And there's no taxes when you withdraw. And so it's been used as this alternative, and you were part of that in 2003 as the HSA was instantiated, and it's grown now. There's over 40 million accounts holding $170 billion in value. Over half of that sitting in cash, in fiat, melting away. These are people who have been able to save for their future health. They know that they're human, and they're gonna have future healthcare needs, and they think it's doing great in their HSA, and it's just getting debased away because of the underlying money is broken, right? And so, actually, I'll tell a quick story and then get to the Little Sound HSA origin. But when my wife and I were traveling at the end of 2021 into 22, we were going from Africa and then over to Bali. And in order to get into Bali, you had to quarantine for a week in a hotel room in Jakarta. So we were locked in this hotel room, and I'd already left my job, and so I was just walking in circles, just thinking about how are all the ways we can bring Bitcoin into healthcare? There are so many things, as you've heard about, that are broken, and so many solutions that we're going to need to be there for people. The HSA is an obvious one, but I thought the tax, compliance, all this stuff, kick it down the road. You have accepting Bitcoin as payment, maybe ultimately have some kind of Bitcoin-backed insurance. And then that's where, Crowd Health, this time had come already at that point. Stu had this idea for a Bitcoin HSA in 2022 and couldn't find a trust company to take on the business, right? There was no interest in doing that. Fast forward a little bit, and we connected a little over a year ago, and the environment had changed, right? We had another election. There's a better environment now to be trying to build a Bitcoin product, and explicitly Bitcoin only, real Bitcoin, to be held within the health savings account. So not a proxy. You could have held strategy stock, maybe you get an ETF, but real Bitcoin. And why do we think it's important for real Bitcoin to accumulate now within the HSA? Because when you have something down the road and you need to spend, well, now you have a value in an asset that's been appreciating 50% year over year for the last decade. And you can set it and forget it in a lot of ways. For Bitcoiners that know, it's a low time preference. I'm thinking towards the future. So the HSA being already, though, this established market, it's already existing, versus kind of creating something that's totally new where we need to head, but it's like bridging the gap a little bit from where the market is today, especially in your world in the employer space. And 60% of people get their HSA through their employer. But as you spend less and less time with an employer and are jumping around, this is an instrument that you take with you beyond that. So it is, as a product, already something a bit more sovereign, and now we're trying to magnify that by putting Bitcoin in there.
It's a really good point, because it's the individual's money, the account holder's money. They do take it with them. It's portable. Full disclosure, like Rod, I'm also a Bitcoin, a Sound HSA customer. So I've got some money in this as well, just because it's a great idea. I just want to do a follow-up with you, John, before I ask Andy a question, and that is how are you guys navigating the regulatory and compliance space, and especially what has to move for this to scale beyond the early adopters?
Yeah, so initially it's finding a trust company, and so what we're doing at Sound HSA is really building a lot of that tech layer. We have a mobile app, we have a web app. It makes it a process of a self-directed retirement account that's normally very cumbersome. You have a lot of PDF files. It's a pain to open up. Making that easier, modernizing that, right? And then, so finding Horizon Trust, based out of New Mexico, they're already doing self-directed instruments and really take customer service deeply. Because a lot of the HSA, what you're doing, you might be transferring from another institution that doesn't want to give up their money because they're making some percentage points on that money sitting in their HSA account. And so ultimately, though, now with Bitcoin and where we're moving towards, we're really excited to share that we're moving to a multi-institutional, multi-signature setup with Bitcoin. Because one of the beautiful things about Bitcoin is that you can see it on chain, right? You have an address, and here's the Bitcoin. We want to try to remove as many counterparties from the middle. So we're going to be partnering with Unchained and Gannett Trust out of Wyoming and Horizon Trust as the third key holder. So the Bitcoin will be held in a multi-institutional, multi-sig, real Bitcoin, which now frees up other opportunities for us down the road to potentially spend out of the HSA. It's very explicit that fiat needs to come into an HSA, and then you need to convert to Bitcoin. But we believe we can actually now, from a compliance, be in compliance and spend Bitcoin on the distribution side down the road, which now builds more of this circular economy, having more demand. In the meantime, you can spend on healthcare, save your receipts, and reimburse yourself at any point into the future. So if that's sitting in Bitcoin, it's a tax-free piggy bank. Understand not everybody can afford to do that. And one of the big issues from a policy perspective right now with the HSA is that you still need to have a high deductible health plan, which sucks. We would love to get rid of that. And that anybody in the country, any American, can have some tax-advantaged money saved for their future health, because we're all human. And so I think that's where we're, again, in this transition period. And so, if you have health insurance, the HSA is an amazing tool. We would love it to be available to anybody, but I think that's ultimately how this thing really scales, is because all of a sudden there will be some policy shifts, I think, in the future to enable that. Because a lot of us here have been delightfully uninsured for a few years. I've been after working at Crowd Health and as a member for 4 years, coming up on now. But I did go to the marketplace to get a high deductible plan, really as a throwaway, not for the family, but the lowest cost I could get, so that I could get the HSA and get some Bitcoin in it, because I'm kind of betting that, okay, Bitcoin's going to double in the next 30 years. I think so, right?
Double. 10x.
Yeah, no, like at least. Okay, this is gonna, because that's my time horizon for thinking about some of the money in the HSA. So it's, as you know, it's can be a maze navigating regulatory and health, and especially and be interested to hear, you answer that question as well from not being health insurance and navigating that environment. But it's constant. So being at this intersection of healthcare and Bitcoin, where you already have a lot of regulatory considerations, and now we're bringing in new money that the system might want to pigeonhole as just an asset. And yeah, it's great as long-term savings, but we know it can be so much more.
All right. So let's talk about something else that's in the room. There's woefully low healthcare literacy in this country, right? And when it comes to employee benefit plans, 1 out of 4 people would rather have dental work than go through their open enrollment. I mean, no offense to the dentists. So, we've got a woefully, and I can imagine your idea is hard to get through to someone so used to what's standard. So explain how crowd health works, how it's conveyed to normal human beings. And then as a follow-up, what happens in this 20,000 life group? What happens if one person has a major claim? How do you treat that? So first, how do you address the literacy? And then what do you do for getting people on board to understand it? And then how do you pay for a big claim?
Yeah, I think on the education side, it's hard because I think we've all been psyoped to think, since we were little kids that you have to have health insurance. Our moms are telling us, like, you don't have health insurance? Like, this is crazy. And so, it really was, we had 9,000 customers this time last year. We have 30,000 customers today. So we've tripled over the last year. And so I think ultimately what is happening is our education is we're low time preference, which is, it just takes some time, and I need those stories to tell because I think that people really resonate with the real stories. And as entrepreneurs, if you ask an entrepreneur, like, what keeps you up at night, right? When I was at 1,000 customers, I was worried about the NICU babies and the cancer cases and those types of things. Now we're at a point where we have one of those cases, and we have lots of them. I'm actually excited to be able to help this family navigate this system without having health insurance because they get way better care. They get way better outcomes from what we're seeing. And I can then tell that story to people being like, hey, this person did have a cancer case. We got Travis who had stage 4 cancer. The doctors are going to put him on palliative care. Like, you're done, dude. I think he said, I'm on the escalator to death. That's what they put him on. And because of the way we work, we say, hey, this is between you and your doctor. You guys get the tests you need, what the medications you need, whatever it is. And now Travis, a year later, is cancer-free. And so we truly believe that if we can tell more of those stories, it gets people comfortable with the fact that you don't need health insurance. We have a T-shirt that says uninsured on the front. We're not shy about it. It's like, this is different than insurance. We think it's better. People's like, oh, well, you're not insurance. And I was like, I think Bitcoiners will get this. This is a feature, not a bug. People are so pissed off with health insurance. The latest Kaiser Family Foundation data came out a couple weeks ago, and 19% of claims are denied. You have a 1 out of 5 chance. 200,000 families every year are going bankrupt due to a medical event, even though they have health insurance. This is a problem. People are seeing it. They're annoyed enough that they're willing to give us a shot. And then with the big claims, we call them health events. We've had dozens and dozens and dozens of cancer patients. They've all made it through. 100% of those bills have gotten funded. The community can do it. Yeah, I was worried about it at 1,000. We're at 30,000 now. And I think people need to understand, too, that the finance mechanism of health insurance is that they are contractually obligated to pay these hospitals and therefore have kind of chunky payout systems where if you have a $1 million liver transplant, that health insurance plan has to pay that, within the next 60 or 90 days. For us, it's a little bit different. Let's just say somebody goes into the NICU and we know they're going to be there for 2 months or wherever. This is going to be $1 million bill. Well, we go out to the community and start funding now. They're not going to get out of the hospital for 2 months. They're not going to get a bill for 3 months. We're going to negotiate it for 3 months. And then you can stretch out that payment over a period of time, so you don't have these huge wide variations in the ask from the community. So you're basically, the hospital is financing this for you at 0% interest rate, and that allows us then to negotiate with the hospital a fair price. So we actually have a negotiations team who will call that hospital and be like, look, we know the bill is $1 million. We know you're trying to charge 4x of Medicare. Let's have you make some money, but we also want a fair price. And so let's, negotiate it down to, 140% of Medicare. You're still making money. The patient's good. And so we've been able to do that now 40,000 times over the last 5 years. And like Kaiser Family Foundation said, 20% of bills are denied with health insurance. 99.9% of the bills that are funded or that were submitted to the community were funded. That 0.1%, we have some gamification in this, whereas when we have a bill come in, we go and ask a certain number of members from the community, and they can voluntarily give to another person. So then the question is like, well, why would I voluntarily give to somebody I don't know? Well, you can say no, but if you say no and then you submit a bill to the community will see that you said no to other people in the community. And so it's an accountability feature within the community. The other cool component of this too is I think we need market-based forces in healthcare. As of right now, they're non-existent. I thought that big United Healthcare, top 10 largest companies on the planet by revenue, would use its weight to negotiate really good prices for me. But in essence, they don't. The weird thing about healthcare, and people think like healthcare is really complex, but it's not. You have the sellers of healthcare, these hospital systems. They clearly want the highest price. That's free markets, great, I agree with that. But the problem is that the buyers of healthcare, health insurance plans, also want the price to go up. And people don't understand that. So what in essence is happening, thanks to the Affordable Care Act, you're maxed out on the amount of profit that you can get as a health insurance plan. So if my premium is $1,000, the max you can make for administration and profit is $150. So how do they take that 150 and turn it and grow it by 10% to get it to 165? Well, guess what? Your premium has to go from $1,000 a month to $1,100 a month. So it basically becomes a cost plus system, not too dissimilar from what we're seeing in the military industrial complex, and therefore incentivizes costs to go up and not to go down. So if you have the buyer of healthcare and the seller of healthcare both wanting the price to go up, guess what? The price goes up. You don't need to be safetying with a PhD in economics or whatever to understand that if the buyer and the seller want the price to go up, the price is going up. So we've built a system to enable free market kind of basics economics, and we found that our members over these 40,000 bills have seen they're paying 50% of what United Healthcare is paying for the exact same procedure, and oftentimes in the exact same place.
Thanks, Andy.